Hi everyone. In this video I'll be speaking about the topic of eating disorders and looking at this from a holistic perspective. So a mind, body, spirit approach to help people address these particular patterns or issues in their lives. For those who work in the mental health field, you may be familiar with a lot of this information. For those that are not professionals in that area, you may be uncovering or discovering more things that are new to you. Even for people who are mental health professionals, there often are a lot of gaps in understanding or even misunderstandings about these topics, about how to effectively and efficiently approach helping people heal from eating disorders. These disorders are, in a sense, symptoms of deeper underlying psychological and psychosocial issues. So if you're focusing just on the eating behaviors, you're not really addressing the root or cause of the particular problem. So you need to really look at the person as a whole, looking at their underlying personality structure, their psychological patterns, unresolved past traumas, the family dynamics, the person's core beliefs, the emotions that they're carrying with them. So all of those factors are present, and in some way those are the causes or issues that are fueling the eating behaviors. So whether a person has anorexia or bulimia, if they're binge eating or purging, if they're hypervigilant about what food they're consuming, all of those particular patterns may be expressions of some deeper underlying psychological concern, some underlying anxiety, depression, self-worth or self-concept issues, fears or insecurities in their interpersonal relationships, issues with power or control, issues with sexuality or intimacy. These are all common cofactors, coexisting concerns that are present in people who are displaying the patterns that get diagnosed as eating disorders. Since there is this very high correlation among these factors, it's important to address all those particular issues, to really work with the person on their cognitions, on their emotions, and especially on whatever things are stuck at a subconscious level. Like other forms of compulsions or obsessions or addictions, these patterns are being driven from a subconscious level. So even if you educate a person about nutrition, about healthy eating habits, those subconscious factors can still be there, still controlling how they actually act and function. So if a person has some unresolved issues about their power and control in their family, issues from their childhood, even issues that are reoccurring now in their adult relationships, we can't resolve that simply by trying to train the person to change their eating routine. This is something that we really need to address holistically. So it may include counseling, psychotherapy, some form of cognitive restructuring or reprocessing. Also mind-body approaches, helping relieve stress, tension, and anxiety, using things like massage and acupuncture and Reiki, meditation, breath work, sound healing. Also going into the subconscious using hypnosis and regression therapies, So to help re-access or reconnect with parts of the person's psyche or consciousness that have been stuck in responding to some past trauma. So the particular eating behaviors that are a concern may have been developed at some point as a coping mechanism, as a strategy for a person to experience some type of psychological control or some type of emotional relief or release. So there is some seemingly positive purpose behind those patterns. Some part of that individual's consciousness believes that there is some positive consequence or outcome from maintaining those patterns or behaviors. So if we just try to tell the person that what they're doing is unhealthy or wrong in some way, if we're just being critical and judgmental about that pattern of behavior, we may actually be in some way further exacerbating the underlying insecurities, the underlying disturbance in that person's sense of self. So we wish to actually help rebuild or re-nourish and re-nurture that person's self, that sense of who they are, of how they fit into the world, of their own value and their own power. This is where these subconscious healing approaches can be very valuable, where we can bring to conscious awareness whatever aspect or part of the self has been traumatized or stressed, that part that hasn't had the opportunity to mature and perceive things in a more healthy and balanced way. Often it's a child version of self that is producing a particular behavior pattern, and to the point of view of that child self, what they're doing is constructive or protective. So we can't just directly go in and pull away that protective mechanism. We need to integrate those different parts of the person's consciousness so there can be a healthy understanding that is brought to all parts of the self, so that they can be brought together toward making the positive changes, rather than there being some internal conflict where one part of the self desires to make a change and another part of the self is holding on to the past pattern because it believes that pattern of behavior is vital or essential to its well-being. With many psychological issues, this is the dilemma that we face. We may consciously realize that we need to make a change, that we're caught up in some unhealthy pattern, but to that other unconscious part of the self, that pattern seems necessary or constructive. So we need to form some communication between these aspects of ourself to bring this higher level of awareness into that deeper part of our consciousness, so that all aspects of our being can have this integrated or unified awareness. So often in therapy I work with hypnosis, with energy psychology techniques, with methods for helping calm the nervous system down, for helping the person kind of relax and settle so that they're not stuck in a reactive or impulsive mode, so that they can be more fully present and self-aware and choose a behavior or activity more mindfully rather than from some unconscious emotion-driven impulse. We also can explore how our personality develops, how we conceive of ourselves in relationship to others, how we deal with issues of power and control how we perceive our body image, our sexuality, our role in intimate relationships. These all can be factors that are in some way affecting those eating patterns, those behaviors of how we nourish ourselves, of how we treat ourselves. So for those that are looking for some support or guidance or treatment for eating disorders, I would recommend looking for holistic approaches that address all these different levels of your being, that help really get to the root of your personality and self-concept, to your core beliefs, to help you release or resolve some unprocessed emotions that may be in some way guiding your behavior. Note that there is this potential for healing, that no matter what pattern that we've been playing out in our life, we can evolve beyond that. Change is actually natural. Nothing is actually permanent. So at least in some small or subtle way, we are always evolving and transforming. So whatever patterns you may feel you've been stuck in, whatever undesirable habits or behaviors you may feel are controlling you, you have the power and the potential to shift and transform, to develop a new sense of self, a healthier version of who you are. You have the power to feel more at ease with yourself, more confident, less anxious or stressed about things in your life. And this is my wish for each and every one of you, to feel more healthy, more happy, more balanced and whole. For those of you that are exploring holistic health, spirituality, and natural healing approaches, I invite you to watch more of my YouTube videos. You can also visit my website, phinsights.com. That's phinsights.com. For now, I'd like to wish each of you a wonderful day. Namaste.